Hi, I'm Dr. Allegra at Northwest Face and Body, and today I want to talk a little bit about laser resurfacing and some of the hybrid techniques that I've been employing for some years that I think offer an interesting combination of both effectiveness but also with ease of recovery, which I think is a very key factor in laser-related resurfacing procedures. Basically, what we're treating is the effects of wear and tear, UV damage, sun exposure, which is clearly the major factor resulting in the adverse changes that we see. This is going to result in loss of elasticity, fine lines and wrinkles that start taking place, some degree of pigmentary changes, blotchy changes. And also individuals who have acne scarring can sometimes benefit from techniques of this kind. Over the years, many different techniques have been evolved and developed, all based on essentially creating a controlled injury to the skin, which then results in a healing that takes place in a smoother fashion, thus reducing or in some cases virtually eliminating fine lines and wrinkles, also generally tightening the skin quality, restoring the actual health of the skin. Looking at the skin from a medical point of view, we restore a better architecture. We restore a more youthful skin. We actually are able to reverse some of the old UV damage. These are techniques that actually are very effective in people who are prone to skin malignancies. Often there's a dramatic reduction in the rate of little skin cancers that can take place after laser resurfacing. The evolution that we have looked at and that we have really incorporated into our practice is using the laser in two fundamental modalities. The CO2 laser that we own is able to operate in what's called a deep FX mode. And what this is creating tens of thousands of incredibly minute perforations that go all the way through the dermis. And what this is doing is stimulating the dermal tissues. And this is what regenerates collagen integrity. It creates smooth sheets of collagen as opposed to the more jumbled sheets that happen after UV damage. It also does increase elastic fiber composition so that you have a smoother, more natural skin. And then we do a very light surface pass that just de-epithelializes. It creates a refreshing change in the surface skin, if you would. That combination is essentially total FX. The beauty of this technique is that it offers significant overall improvement and yet a dramatic reduction in the healing time as opposed to older laser resurfacing techniques. Some of the older techniques were purely ablative, meaning that we would just basically go through layer, layer, layer all the way down to the dermis, and then the skin had to regenerate from the deepest layers up. Quite effective, but also a very, very long healing time. This is something where there would be individuals who would be red for, quite frankly, months. This, we feel, is not a terribly acceptable trade-off, if you would. Yes, the results are great, but quite a bit of healing. With this technique that we've been employing, we have very rapid healing to the point of being basically socially presentable at 1 week to 10 days, easy to cover up with only some pinkishness of the skin quality that might persist for a few weeks. And yet, we're able to get significant improvement with this relatively modest recovery scenario. Interesting developments in the use of the CO2 laser. If you have some skin changes that you feel might benefit from this, we offer a free consultation at Northwest Face and Body. Thanks.